Reproductive system drugs lecture. The reproductive system has hormones that regulate its function. There are four main categories of hormones that we will be discussing in this lecture. We have the gonadotropic, androgens, estrogens, and progestins. Gonadotropic hormones we think of as the follicle-stimulating hormone, or FSH, which stimulates the development of the ovarian follicles in the female. It also stimulates sperm production in the testes in males. We also have luteinizing hormone, also abbreviated as LH, which works with FSH to induce secretion of estrogen, ovulation, and development of the corpus luteum. And then we also have the luteotropic hormones, or LTH, which stimulates the secretion of progesterone by the corpus luteum and secretion of milk by the mammary glands. Androgens are the male sex hormone, which stimulates development of the male characteristics. Two different examples are testosterone and androsterone. Androgens are used for replacement therapy in patients who have maybe a decreased level of testosterone or may not produce any at all, such as a congenital form of hypogonadism. In those types of situations, we give supplemental testosterone in the form of androderm or androgel. Most common placement of these types of testosterone are the inside of the thighs or the inside of the arm, on the underside of the arm. It is important that patients wash their hands after using this medication, and females should not handle this medication unless prescribed it, because this can affect their reproductive cycles. Androgens are also prescribed for patients with tumors or had radiation or chemotherapy and no longer are producing these hormones. We also use them in a palliative way for metastatic carcinoma of the breast or breast cancer that is non-treatable. In this case, we are prescribing methyl testosterone. We can also use androgens for the treatment of endometriosis, and in this case, the common medication prescribed is Danzol. And sometimes for endometriosis, which is not an androgen, we will prescribe Lupron. Some of the common side effects of androgens when taken are edema or weight gain, acne, and excessive hair growth. Erectile dysfunction medications. Erectile dysfunction is defined as the inability to achieve or maintain an erection sufficient for intercourse. Oftentimes we are prescribing PDE inhibitors. PDE stands for phosphodiesterase inhibitor, which works by relaxing the smooth muscle and increasing blood flow to the area causing an erection. Common medications prescribed are sildenafil or Viagra, tadalafil, which is also called Cialis, and vardenafil, which is called Levitra. It is important to note some of these medications are used for other medical conditions and can be used in males and females. Sildenafil can also be called Revadio, and tadalafil can also be called Adcirca. And they are the same drug, but they are different names because they are used for pulmonary arterial hypertension, or pulmonary hypertension for short is what most medical docs will say. So patients will be prescribed Revadio and Adcirca, which is still the same drug. These drugs usually are given to patients through a specialty pharmacy because of their expense. Many times these drugs are thousands of dollars a month compared to your Viagra, Cialis, and Levitra, even though it is the same drug chemical formula. But that is the drug company's discretion as to how much they charge for these drugs. But it is the same drug. However, specialty pharmacy is needed for the Adcirca and Reproductive, but the specialty pharmacy is not used for Viagra, Cialis, and Levitra. And we will talk about specialty pharmacies a little bit more in class. Nitrate medications should never be prescribed with PDE inhibitors, mainly because they both vasodilate and can cause a severe drop in blood pressure. Some common side effects of erectile dysfunction medications are flushing, headaches, and tinnitus. Estrogen is the female sex hormone. It is important in development and maintenance of female reproductive system. Mainly used in combination with progesterone as a contraceptive or as hormone replacement therapy in postmenopausal women. We also can use this to prevent osteoporosis in postmenopausal women, and we can also use it in advanced stages of prostate cancer. Some of the most common drugs used for postmenopausal women is estradiol or estrase. It also comes in a gel, which is estrogel, or conjugated estrogens, also called Premarin. Some of the side effects to estrogens are increased cardiovascular risk. You have an increased incidence of hyperlipidemia, especially the triglycerides, which can then cause hypertension, coronary artery disease, myocardial infarctions. It can also cause edema, which in turn causes weight gain in patients, headaches, and then it also increases the risk of gallbladder disease. Estrogen should be discontinued if a patient becomes hypertensive while starting or on treatment, or liver dysfunction, or the symptoms of aches, the acronyms aches, which we will go over in a little bit. Progestins are used in the treatment of amenorrhea, endometriosis, and functional uterine bleeding. They are also used as a contraceptive. Progestins are the ones that usually tell the uterus lining to shed. So this is how it prevents pregnancy, is by activating the uterine ripening to create a menstrual period. Some of the drugs that we use are medroxyprogesterone or Depo-Provera, which is very common. It's an injection given every 12 to 14 weeks. It can be used as a birth control. It can also be used for endometriosis by eliminating the period for 3 months. Sometimes patients will not get a period in between injections, and then some patients will get a little bit of breakthrough bleeding with the injections. Some of the side effects are menstrual irregularities, which I just talked about, edema or weight gain, and then thromboembolic disorders, meaning DVTs or blood clots that may form. If a patient has a history of thromboembolic disorders or a history of smoking, they will not be put on these medications. That's why your doctor asks you if you are smoking when they start you on a birth control. Contraceptive agents, estrogen and progesterone, are used as oral contraceptives. So they suppress the release of the follicle-stimulating hormone and the luteinizing hormone in the pituitary gland, preventing ovulation. That's the estrogen part. The progesterone, only the contraceptive that prevents pregnancy by inhibiting ovulation changes and thickness of the cervical mucosa. So progesterone also increases the cervical mucosa, the thickness, preventing pregnancy, but it also changes and sheds the lining of the endometrium before the egg can attach. Birth controls. So this is what a birth control pack will look like. Some birth controls will have a consistent dose of estrogen and progesterone throughout the weeks. Some will have a tapered dose, so it will be real strong to begin with, and then maybe for the first 2 weeks, and then it will taper off this 3rd week. So there are different types of birth controls. So if you are having breakthrough bleeding or symptoms, you can call your doctor and they can put you on a different type of birth control that maybe has a little bit more progesterone in it or estrogen to prevent those breakthrough bleedings. As you notice, the last week is a different color, and these are placebo tablets. They are basically sugar tablets, and some people say, why even put them in the pack? But some people need that habit of taking their birth control every single day at the same time of day, and it doesn't matter. So that's what this is. So they are still taking that pill, but they are not getting any estrogen or progesterone in this last week. So they get that menstrual period towards the end of this week. There are many different ways of starting an oral contraceptive. This has changed in recent years, and some of you probably are like, what? I've been started on birth control and that's not how I've been started. But there are several different types of ways of taking the birth control or starting it, and it really depends on the provider. So one method is first day start. You take your first pill during the first 24 hours of the menstrual cycle, and this is when no backup contraceptive method is needed, when the pill is started on the first day of the menstrual cycle. A Sunday start, the second way you can take it, is wait until the first Sunday after your menstrual cycle begins to take your first pill. This option, you should use another birth control method for the first 7 days of the first cycle only. And then the third option for starting a contraceptive is a 2-day start. So start the pill today. If you have had unprotected sexual intercourse since the last period, perform a pregnancy test prior to starting the pill. And if it is negative, you can start the pill. And you should use another form of birth control for the first 7 days of the first cycle of use. So there are several different types of ways that you can take or start the birth control. It is important to coach patients on taking it at the same time every day. And it is also important to coach patients to use backup contraceptives when taking antibiotics. And then also reporting any symptoms of aches. And many people are like, what is aches? Aches is A is for abdominal pain, C is for chest pain and shortness of breath, H is for headaches, E is for eye problems, and S is for severe leg pains. So it's really important that we coach patients in reporting these symptoms. These are serious complications and contraindications of the birth control. There are some other more mild side effects of birth control, which can include weight gain, low libido, mood changes, and breakthrough bleeding. And these are things that do not need to be reported to the physician. Choice of contraceptives. So like I talked about earlier, there are several different types. There is the monophasic, biphasic, triphasic, and then there's the four-phasic types of contraceptives. And you don't need to know the difference between these different phases or what medications fall under each, but just know that there are different phases, and that gives you different dosings of the progesterone. Biphasic and triphasic formulas deliver the hormone similar to the normal body cycle, so these are the most commonly prescribed medications for contraceptives. We oftentimes will consider patient history, hormone-related side effects, prior use, and what the desired effect is. So there are also other choices of contraceptives besides the pill. There are some progestin-only type medications other than Depo called the Mirena, as we have pictured here, and this is a little device that is inserted into the patient and it gives coverage for 5 years. We also have some postcoital contraceptives that should be administered within 72 hours, and some of these are now over the counter for patients to buy at the local pharmacy. However, there are age requirements for purchase on some of them. Plan B, one step, which is pictured here. You take the first tablet as soon as possible within 72 hours of protection, and then you take the next tablet 12 hours later. And there also is next choice and seasonal. I would say Plan B, step 1, is the most common. Some common oral contraceptives are orthotricycline or orthotricycline low, which has a lower hormone level of progesterone, Ortho-Nuvum 777, Seasonique, Librel, Yaz, Yasmin, or Noril 1/35. And these are just the amounts of hormones. This one's more consistent. This one has less hormone in it. Drugs for labor and delivery. So oxytocin stimulates the uterus to contract and stimulates milk release. Prostaglandins are used for cervical ripening in cases of therapeutic abortion or postpartum bleeding. And mifepristone is used to terminate an unwanted pregnancy. And then magnesium sulfate vasodilates to help prevent or help with the preeclampsia that can happen in pregnancy.